Hi, welcome everyone. So I know some folks are wondering whether or not the audio has started. So the audio has now started, and I'll ask Carla to go ahead and put in the chat that the audio has now started yet in case anybody is still troubleshooting their audio. Oh, wonderful, you can hear me. Thanks so much. So hello everyone, and thank you for joining us today for our webinar. So our webinar today is Understanding the Dimensions of Substance Use and Why Survivors May Continue to Use Substances. This is the second in a series based on our new guide, and our new guide, it just came out at the end of September, beginning of October, and it's called Committed to Safety for All Survivors. So in our webinar today, it's hosted by the National Center on Domestic Violence, Trauma, and Mental Health. I'm Gabriela Zapata-Alma, and I'm the Director of Policy and Practice on Domestic Violence and Substance Use with the National Center, and I'll be today's presenter. So before we get started, I want to go through just a quick orientation to the technology, since I know many of us may be new to this particular platform today. So here's some of the pieces around the WebEx software. Many of the details that I'm going to go over are also explained on the Using This Webinar System tab in the center of your screen. So you can switch this screen from the slides by clicking the down arrow next to Using This Webinar. So please be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. Third from the bottom is the chat feature. You may have to click on the chat cloud icon at the bottom center of your screen to open up your chat box. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as to get in touch with myself or with Carla if you have any questions. So you can, submit questions around the training content, and I'll be happy to answer those. And you can also contact Carla Alegria, also with the center, if you have questions about troubleshooting the WebEx software. So in order to contact Carla, you can click the down-facing arrow and select Carla or select whoever you would like to contact. So when you click on the downward arrow in the chat box, you'll see a lot of options. So if you want to send something to everyone, you'll want to select all participants. And if you want to contact just myself or Carla, then you would want to select one of us. And you can do that anytime during the session. But again, just a friendly reminder to click on Carla Alegria if it's about troubleshooting the WebEx software. So let's go ahead and test this chat feature. Will everyone please go to the chat box, click on all participants, and type in where you're calling from today, and then press enter to send the message. Great, I feel all your responses coming in. Folks joining us from all over, how neat. Amazing, thank you everyone. So while folks can get a lot out of the chat feature, sometimes it moves really quickly and it can feel distracting. So if this is true for you, feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you want to. And we will be providing live captioning during this webinar. So below the chat box, there is a media viewer box, and this will contain the captions. If you don't want to see the captions, you can click on the down-facing arrow next to the word Media Viewer, the same way you would if you wanted to hide the chat box. So we'll have time for Q&A towards the end of the webinar, so please feel free to go ahead and put those in the Q&A box as we go along. And at the very end of the webinar, you'll be taken to a brief survey. please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, go back to the email you received with the original webinar link and just come back, just re-enter the training again. Sometimes sound can cut out because of an internet connection, so feel free to call back in if that's a problem. And again, if you're experiencing any technical difficulties and for some reason you're not able to contact Carla Alegria, you can also call WebEx Tech Support to resolve any issues. That number, which Carla will also put in the chat box, is 1-866-229-3239. And we have a couple of handouts for today's webinar. You don't need them for the webinar, but they just kind of go along with the webinar. So Carla has posted a link where you can access those handouts. And then also after the webinar, about, like a week after the webinar, you'll receive a follow-up email with a link that will take you to the webinar recording. And then the handouts will also be found in that link as well. But like I said, you don't need them for the actual webinar. They're just kind of helpful handouts. And again, thank you for joining us today. So we're going to go ahead and get started now. Oh, and of course, let me mention that the guide that this webinar series is based on is available for free download on our website. If you just go to our main webpage, you'll see a link on the right-hand side that goes right to it. So it's pretty easy to find. And of course, if you have any trouble finding it, we're more than happy to help. All right. So there I am. So like I mentioned, I'm the Director of Policy and Practice on Domestic Violence and Substance Use. A little bit about me and my background. I also teach at the University of Chicago in the School of Social Service Administration. And there I oversee the addiction training program. So when students are going for their master's in clinical social work, they can also get trained to be a substance use disorder counselor and get their certification through that program. And before, in the past, I've worked as a director of a formal treatment center as well as a director of housing programs where we had transitional housing programs and, as well as outreach programs and all kinds of resource advocacy programs. So I have spent over 15 years dedicated to really supporting survivors in kind of all different kinds of circumstances. And a little bit about the center. So the National Center is we're a FIPSA-funded special issue resource center dedicated to addressing the intersection of domestic violence, trauma, substance use, and mental health. And here you see some of the major activities that we engage in. So we have a whole lot of training and technical assistance services and resources. We also conduct research and evaluation, policy development and analysis, and public awareness. And of course, our government disclaimer that we're very grateful for our, for the support that we receive, and the things that I say on this webinar do not necessarily reflect the official positions or policies of the U.S. Department of Health and Human Services. So at the center, this is our integrated framework. So everything we do is really rooted within this framework of survivor-defined approaches, physical and emotional safety, relationship and connection, and that this is what makes it, it's through all of these that we're able to really foster hope and resilience. And that with this as our core, we then are also, informed by and really integrating advocacy-based approaches, empowerment-based approaches, a trauma-informed approach, an approach that's really rooted within human rights and social justice, and has an awareness of and responsiveness to cultural, historical, and community context. So the topics that we're going to cover in the next, just under 90 minutes is the connections between substance use and domestic violence, understanding the intersecting factors that can contribute to ongoing substance use. So a big focus of this guide is going beyond a conversation that's just about treatment. That a lot of times, we have, if we only stay in the conversation of whether or not somebody wants to go to treatment, then we're going to miss a lot of really important opportunities for being able to offer relevant support and relevant resources. And, the fact is that the vast majority of people who use substances don't feel ready to go to treatment, and there's a lot of reasons that treatment isn't accessible for people. And we'll talk a little bit more about that in today's session. And so if we get stuck on just the whether or not to go to treatment conversation, then there's just a whole lot of folks that, we could be offering all kinds of support and resources to that, we'll just kind of get stuck at that conversation. And so here, in order to really be able to offer relevant support and resources, part of that is being able to have empathetic approaches and understanding what are all of the different factors at play for why people are continuing to use substances. And it's not as simple as just stopping, right? If it were that simple, then we wouldn't be having conversations about it. We wouldn't be having a whole, webinar series based on it, right? And so also today we'll be talking about tips for opening conversations about substance use within advocacy settings, and also a framework for thinking about and unpacking the uniquely personal dynamics of substance use. So that really helps us understand really somebody's kind of substance use from both a trauma-informed approach, from a kind of advocacy-based approach, and also helps us understand from a strengths-based approach of kind of what's going on for them and what's going well, what's not going well, and as they define it. And then how could we potentially offer some, self-defined resources and supports, right? And so always remaining within our advocacy approach, right, of survivor-defined needs and solutions, and that survivors really know what they need in that moment, what's safe for them, what feels possible, and what would feel helpful. And it can be easy to kind of slip out of that when substance use comes up. We can feel pulled in a lot of different directions and not really sure how to help. So I'm really happy that y'all are here today for all these reasons. And so here's just a picture of the guide. So it's available. Everything that we're going to go over today is included in the guide. This is just kind of going a little bit deeper and kind of unpacking it a little bit more. So starting with why might survivors use? So here we're going to be really clarifying the connections between substance use and domestic violence, including the intersecting factors that contribute to ongoing substance use, and then talking about tips. And this is one of the sections of the guide. That's why I want to make sure to kind of highlight, pieces in the webinar back to the guide so that then when you're kind of referencing the guide, you know where to look. So first, reflecting on substance use coercion. So this is where substance use really gets leveraged in tactics of abuse. And this is, wanting to really first start with stories from survivors. And that this was the story that a survivor shared with us, her experience that she shared with us during a survey that we conducted with the National Domestic Violence Hotline. And so I'll just read it out loud. He threatened countless times to call the sheriff and the pastors and report my drinking. He discouraged me from getting help for my drinking. After I got help for drinking, if when I drank again, he would say, "See, you failed at this too." He would leave bottles all around when I was in recovery. And so we can see, right, how the substance use becomes another kind of tactic of abuse that's used to emotionally abuse and shame survivors, that's used to isolate them from potential sources of support, like in this person's situation, the sheriff, pastors, discourage the survivor from getting help for drinking, and this was found to be really common, a really common experience among survivors. And so, I want to start here because first it's always important to start with the voices of survivors, but also because it can be easy for, I know before I was trained in substance use counseling, I felt just really out of my depth with anything that had to do with substance use. And when substance use would come up, a lot of times, sometimes I would feel like a sense of panic. I'd be like, okay, what do I do now, right? I don't know what to do. And other times I would feel like there really wasn't anything that I could do and that this person just needed to see a substance use professional because I wasn't a substance use professional at that time. And so this is really kind of a normal way to feel when we haven't gotten, really enough support and training around substance use. And yet, if I'm so happy y'all are here today because if we do kind of let that be our main response, if we do let just kind of this, okay, you have to go see a treatment specialist or like, I don't know what to do with you, if that's our response, then there are so many survivors experiencing substance use coercion that aren't getting the help they need from substance use providers because they're not really trained in domestic violence all the time, and then they're getting turned away from domestic violence resources. So it's really being like locked out of systems without any access to help from anyone, right? And so as we can see in this example, it's not just like, oh, this person had, an alcohol use disorder, right, or had a problem with alcohol use. No, it was all intertwined with the power and control that she was experiencing from this partner. And that, as advocates, we're really the specialists in when it comes to being as safe as possible and really counteracting all of that domestic violence. And so we can't turn away, right? We can't kind of say just go to a treatment specialist. And so understanding substance use in the context of domestic violence really requires us to understand substance use coercion. And then we'll talk a little more in kind of future sessions around integrated safety planning and kind of what that means in this context. So now we're going to go through kind of a case scenario, and together we're just going to kind of uncover how substance use coercion is showing up. So we can just practice recognizing the coercion, and the more aware of it we are, the more prepared we are to really offer integrated safety planning around it. So I'll just read this out loud, and then I want to invite everyone to go ahead and put in the chat box what are some of the signs of substance use coercion that you notice, and then what are some of the services or resources that you might offer. So Morgan recently called asking about advocacy services. Morgan shares that she's currently living with her boyfriend because she doesn't have a source of income or another place to stay. She shares that every time she tries to get a job, her boyfriend tells her that she's too sick to hold down a job. Morgan says she's tried getting help for substance use before, but that her boyfriend accused her of having an affair with her counselor. She's tried to find a treatment program where she could see a woman counselor, but hasn't been able to find one. So what are some of the examples of substance use coercion that you notice in this scenario? And what are some of the services or resources that you might offer? And go ahead and share that in the chat. Yeah. So we're seeing that interfering with her attempts to get help and treatment, really sabotaging her treatment, and the accusations, that kind of like pathological jealousy, right? We also see the financial abuse and the keeping her from, discouraging her from getting a job, telling her that she can't work, and all of the isolation, right? We also see the belittling of her. Yes. And isolation in so many different ways. Isolation from really kind of all the other areas of her life. And the manipulation tactics, absolutely. Thank you so much, everyone. And what are some of the services or resources that you might offer? So for folks who are offering counseling, potentially some cognitive behavioral therapy focused on empowerment and building her up. Of course, DV advocacy, specialized women's programming and treatment, support groups if she's interested, including local support like AA and NA and other kinds of mutual aid, housing assistance, potentially residential treatment, connection with a counselor. Yeah, potentially women-only services, and I'm seeing women-only safer use services. Yes. DV Safe House, recovery coaching, absolutely. Local resources for resource advocacy and food assistance. Accessing a zero-barrier access to women's shelter. Excellent, and that has safer use rooms on site in the shelter. Thanks so much, everyone, for your ideas and your input and your resources. Something I love about this is hearing what folks have in their communities, and also for folks to hear from one another what is out there, and you can think about what may exist in your community, and if it doesn't exist, what you may be able to really collaborate with folks and build. Thanks so much, everyone. So, coming back to substance use coercion. So survivors are often introduced to substances by an intimate partner. And research has found that intimate partners play a large role in both the initiation of substance use as well as moving from that initial use to really escalating to experiencing problems related to substance use. We also have found through research that there are a lot of different ways that people experience treatment interference and recovery sabotage. These are just some of the major themes that we have uncovered through research, but this is just, a handful of examples of so many stories that we've heard from survivors and from advocates and from treatment providers. And so, for example, not being allowed to attend mutual aid meetings like AA, not being allowed to seek treatment. And sometimes this sabotage can be much more subtle. It can be something like withholding transportation, being told that the partner would give a ride to treatment and then being nowhere to be found, or that they'd be back with the car before the person's treatment appointment and then, they disappeared. When I was a treatment provider, I remember working with so many people who had, a bus card, and then when it came time for their appointment, the partner had taken off with their bus card. And in talking with treatment providers around the country, one of the things that many treatment providers have instituted is making sure that there are people who can go and pick up a survivor if their transportation has been sabotaged. as well as providing on-site childcare, because that is another huge barrier for folks in general, and then especially for survivors. Many times sabotaging their childcare is a way to then interfere with their ability to access treatment. Keeping substances in the home. So somebody coming back from like a residential treatment stay and there being substances all over or paraphernalia or bringing substances to their homes. And then also for people who have medication-assisted recovery as part of their treatment. So, for example, medications used in the treatment of opioid use disorder or alcohol use disorder, then many times this kind of treatment, which can be life-saving for many people, it's very evidence-based and an important form of treatment, but it does many times require a routine appointment schedule. And so there can be increased risk of stalking and attacks and assaults at these appointments, as well as the stealing of medication, including not just medication used in recovery, but also mental health medication and other kinds of medication. And then trying to use someone's medication to then coerce or control them. And so as advocates, as well as treatment providers, for the treatment providers we have on the session, it becomes really important to safety plan around medication and to support folks in being able to both attend these appointments safely and stay connected to their treatment in ways that are safe for them. And that's, why it's so important to be collaboratively strategizing, that, we're not the ones who can come up with the strategies. We're really there to support brainstorming, but survivors are the ones who know what is really safe for them and what is not possible and not safe for them. And also safety planning around how to maintain control of their medication. So something else to keep in mind is the neurobiology of relapse cues in the context of substance use coercion. That the way that, our kind of memory and learning is largely tied into the kind of our neurobiological response that can cue cravings. And so when we're exposed to substances or other things in our environment that act as cues for substance use, so as kind of like reminders of substance use, these can really increase the experience of craving. And something to note, particularly for women, is that women's neurobiology, hormonal differences have been found that indicate that women experience more intense cravings, and as a result, experience kind of higher rates of relapse. So kind of are at a higher risk of returning to substance use or returning to a chaotic pattern of substance use because of some of the hormonal differences and how that impacts the experience of cravings. Also, that many times kind of cue for that craving experience is stress. So kind of stressful experiences as well as distressful emotions. And so this kind of neurocircuitry can be deliberately activated by someone who is seeking to harm their partner or ex-partner, someone who's seeking to exert power and control over a survivor. So this is another way that substance use coercion can come up. So this is where it becomes really important to understand that DV-informed services are not going to be exiting people or discharging people because of a return to substance use. Because a return to substance use could have been coerced by a partner or ex-partner, or a partner or ex-partner could have been really inducing that state of stress, that state of distress, which then, of course, can activate the neurobiology of relapse. So understanding kind of the connections here between the violence and the substance use is so important, and how that can be kind of like hijacked by someone who's seeking to really exert power and control over their partner. So now thinking about Morgan's situation again, we're going to come back to kind of like chapter 2. So when discussing treatment options, Morgan shares that she's tried to self-detox at friends' houses before, but that her boyfriend would always find her. Before she knew it, she should be back home using with him. She shares that on some level, opioids have helped her deal with the constant ups and downs of her relationship. When you ask about these ups and downs, she responds, "He's always telling me I'm crazy and keeping me up all night fighting. I figure every couple goes through stuff like this." So now, what are some of the examples of substance use coercion that you're noticing in this situation? Right, so encouraging her to use, right? She's not aware of how this is part of the pattern of power and control. The sleep deprivation, yes, that's a huge one. The gaslighting going on. Her attempts at coping with the stress levels, the really high stress levels. Him finding her, right, when she's trying to self-detox, him kind of tracking her down, right? And then kind of taking her home to use again. Yes, the mental abuse, the emotional abuse, the added stress from the fighting and keeping her up all night. And he's controlling. Yeah, absolutely. Absolutely. Recently, I read a study that had been done, and it was a study just on actually opioid use. It wasn't specific to domestic violence at all. But one of the people that they interviewed, and they included what the person had shared, was that the partner was abusing her and then forcing her to use so that she wouldn't be so angry about the abuse, right? So then really like the partner coercing the survivor to use so that he didn't have to deal with kind of her really rightful anger over the abuse. And this is just in a random study on opioid use, right? Had like no specific questions about domestic violence. So this is really pervasive, right? Normalizing abuse, she thinks it's typical, right? And then keeping the relationship off balance to control her. Yeah, absolutely. Thanks, everyone. And then what kinds of supports and resources might you offer? Yeah, so for those using clinical interventions, dialectical behavior therapy can be really helpful to improve, to really build people's kind of toolkits around coping. And in general, we always want to be kind of helping to support that positive coping, helping to expand people's coping skill sets. And there can be so many different kinds of tools that can help, right? So feel free to put in all those different kinds of coping tools that you kind of offer and you kind of help co-regulate with people. There's so many different kinds of coping tools that we can share. Some education around healthy relationships, education around the pattern of power and control. A lot of times people only, think about like physical violence or sexual violence when they're thinking about domestic violence, and understanding the whole pattern of power and control, including how substances get leveraged in that, can be really empowering for folks. Seeking safety, counseling, Seeking Safety Trauma Group. It's a group intervention for both substance use and trauma that's been found effective with survivors experiencing domestic violence. Absolutely. Safe house, in-house therapy. Yes, this can be so helpful for folks to really streamline their services, really streamline access to services that they're interested in. Strengths-based approach, shelter. Absolutely. And given that she's been interested in, withdrawal management services, detoxification in the past, it could be something that we would offer. Absolutely. Talking with her if that's something that she's still interested in, and whether it would be helpful to talk about some resources around that. Absolutely. Yeah, and Megan raises a really important question. How would in-home services play out for the survivor if the survivor is at home with someone who is abusive? And so that requires a lot of creativity and safety planning around what are kind of safe and confidential ways to have those services, and especially in with like tele services, if it's, if an abusive partner has the ability to listen into those services. So there's a lot of tech safety that can come into play there. And then there's a lot of, big barrier, absolutely. And we actually have some resources around that. So I'm happy to talk more about that also. And then also, if folks are in a safe shelter setting, then being able to kind of collaborate with other providers or maybe get some different sources of funding to be able to support some of that kind of in-shelter counseling can be really helpful. But we have to get really creative when folks are, especially if they're sheltering in place with someone who is abusive. Absolutely. And then asking Morgan about, her own perspectives on the relationship. It's really important not to make assumptions and not to assume that Morgan, that we already know how Morgan feels about her relationship or what she wants, with her relationship. We always want to take the position of being a support and an ally and really have Morgan lead that process and just offer that kind of unconditional support. Thanks so much, everyone. So then going just a little deeper into substance use coercion. So substances are commonly used in a tactics to draw survivors back into relationships or keep them in abusive relationships. So some of the ways that this shows up is like, for example, supplying survivors with substances as a way to, quote, apologize. We've heard so many stories of people, escaping a relationship or breaking it off, and then an ex-partner, showing up with substances to apologize for the abuse, quote, unquote, apologize. And then that kind of neurobiology of relapse getting really activated and that person kind of being back to using kind of before they know it, right? Also, controlling survivors' access to substances so that especially if somebody experiences physiological dependence on a substance where they'll get, experience withdrawal symptoms if they're not using a substance, that becomes another mechanism, a really easy way and a really common way to then exert power and control over a survivor. I remember speaking with a survivor who said, trying to escape my relationship and quit drugs at the same time is virtually impossible. That, either one of those was so difficult in her situation, and that if she had to do both of them at the same time, that it really would not have been possible for her. And I remember speaking with another survivor who talked about being able to escape an abusive relationship and but wasn't able to access any kind of withdrawal management services, so wasn't able to access any kind of detox and treatment service, and that when she tried to get substances just in her community to try to deal with the withdrawal symptoms because she was really like just not physically functioning with because of the withdrawal symptoms that, you know, she said it was like she had been almost like marked as property, that anyone that she tried to get, you know, anywhere that she tried to get substances from, she was unable to get any substances from, and that it drove her back to the abusive partner just because she had no other way to deal with the withdrawal symptoms, right? So this is where we see the controlling survivor's access to substances is a really kind of common and deep way to keep people deeply in these abusive relationships. And of course, that involves using the threat of withdrawal or actually forcing people into withdrawal as a way to harm them, as a way to intimidate them and control them. And we see all of this then many times really feed into forcing survivors into illegal activities. And then once engaged in illegal activities, then, of course, threatening to report survivor substance use as well as any other kinds of illegal activities that they've been coerced into, threatening to report those to law enforcement or child protective services. And in talking with DV-savvy treatment providers, that's something that they just, you know, bring up all of the time, that like every single person who's dealing with domestic violence in the and is in their treatment program and also has children, that child protective services is being really kind of wielded as a threat over their head to keep them in the abusive relationship. And then, so there's a lot of need to be able to, you know, collaborate with child protective services, as well as for there to be a lot of DV savviness in child protective services, you know, having child welfare systems that are responsive to the realities of domestic violence, including substance use coercion. And that's actually a lot of the work that our center is engaged in over the next year. So, so more to come. And then, of course, using a survivor's substance use history, including the use of their treatment records against survivors in legal matters, including child custody. So all the time, right, just kind of bringing this up in any kind of legal matters, any way that they can isolate a survivor from sources of safety and support. And this, you know, happens across every area of safety or support, from, you know, keeping survivors from getting like orders of protection or interfering with their work or their education, right? Because of just like the threat of disclosing substance use, the threat of disclosing substance use to children, and how that then is used to coerce and exert power over survivors. And so we know that people who seek to exert power and control over their partners actively seek to undermine their partner's relationship with their children, and that this creates risks for children's health, mental health, and well-being. And research consistently shows that attachment to a non-abusive caregiver is what's most protective of children's resilience and development, right? And so when we are counteracting substance use coercion, it is, you know, something that also is important to really be able to support a survivor and a survivor's family, right? So here's just a visual of kind of everything we've talked about so far with substance use coercion. And the piece that's really new on this visual is the bottom right-hand kind of corner, which is the way that stigma shows up in our systems of care, in our organizations and services, because then, you know, people who seek to harm their partners can leverage the stigma related to substance use in our systems to really further isolate and control survivors. So I mentioned that I worked in housing, right? I worked in housing for over a decade. And something that would happen all of the time is that as a director, I would get phone calls from people who were partners and ex-partners of people who are in our housing. And I would get phone calls. I would somehow find out, my information. I would somehow find out the person was in our program and get my information and call me, and then try to say that people in our program, that survivors, were using substances. And they would, kind of come up with all of these wild stories to try to get me basically to kick the survivor out of our program. Like, that's what they were trying to do. All the time we get phone calls about, so-and-so is just, so one of our programs, several of our programs were scattered site in the community. And so I get a phone call, so-and-so is just having drug parties all the time, and that's why, XYZ is happening, right? And luckily, we were DV savvy. We knew what this was. We saw right through that tactic. But, it requires us to really be aware of all of the ways that stigma against substance use and people who use substances show up in our program, and that we need to be able to dismantle that stigma. Otherwise, we're not only not providing a healing environment for people who use substances, but also it becomes very easy to manipulate us to then just become another part of the kind of spectrum of abuse, right? Abuse tactics. So here's some, different materials on our website for more information on substance use coercion. And so why is this so pervasive? Why is substance use coercion so common? And it's because of the stigma associated with substance use and with mental illness. And that, of course, this is further complicated in the context of structural violence. And so when we think about, substance use conditions and substance use in general impact people of all different experiences and all different backgrounds, all different walks of life across our communities. But at the same time, not everybody has the same access to resources, and not everybody has the same access to resources that are actually responsive to their culture, to their experiences, and to their needs, to their kind of specific experiences and needs. And so when we're thinking about substance use in the context of intimate partner violence, we also need to think about it in the context of structural violence. And so here is a framework, and it's one of the handouts. It's at the Google link. I apologize. This writing is like teeny tiny. That's why it's another handout on its own, so you can really see it clearly. And this is called the Power Threat Meaning Framework. And what it is that it helps us really reflect on the context that goes along with somebody's substance use. And so when we're really trying to understand somebody's substance use, and we're trying to not just, judge it or stigmatize it, but really trying to understand it, this can be a framework that's really helpful and non-pathologizing. So first we look at the impact of power. And here you see listed all different kinds of power, from kind of interpersonal power all the way to more macro societal levels of power. So here what we're really asking ourselves is what happened and how is power operating in this person's life, right? From there, moving into the core threat. So what was the impact? What kinds of threats does this pose to this person? From there, considering the meaning and discourses. So what sense do they make of it? What's the meaning of these experiences to them? is there a lot of like internalized stigma or internalized kind of emotional abuse around it? What does our kind of community say about this person's substance use, right? And how has that impacted their kind of self-concept and the meaning that they make from all of these experiences? And then from there, once we consider kind of the power, the threat, the meaning, then we can start to really consider what kind, how has substance use helped them to survive? And something that I hear time and time again from survivors is that, from all of the problems that substance use raised in my life, including substance use coercion, substances also saved my life at one point or another. Because at one point or another, it was something that, kind of kept me from potentially really moving forward with suicidal ideas, right? And that is a really hard reality to swallow, but that is a reality for so many people. So it's we have to really be able to understand that even though substance use may pose a lot of problems, it also is many times an attempt at a solution. So it's very complex, right? It's not all good, it's not all bad. It can be part of the abuse and also be something that helps someone stay alive, right? And so this is where there's a lot of complexity present, and where being able to use a framework like this, that we can really start to really scratch the surface of some of that complexity, so that we can really partner with people in ways that are truly helpful and truly, centered in their needs, in their self-defined needs and goals. So here are those core reflection questions that I mentioned. So just how we often say that trauma-informed care can be wrapped up in a nutshell, a very oversimplified nutshell, but a nutshell of, moving from the question of what's wrong with you to what happened to you. These are questions that can help us move away from the kind of pathologizing and stigmatized view of substance use and really think about someone's context and how substance use is operating, how it's functioning for them in their context. So also, so on top of substance use coercion, there are so many factors that can influence ongoing substance use. They're often complex and interwoven, and sometimes it can even feel like a mystery to the person who's using, especially when they're finding themselves using in ways that don't align with their goals or with their values. I remember speaking with an advocate who shared with me, talking with survivors who have shared that, they don't want to keep using and they don't understand why they keep using, right? And so there's so many different kind of layers of factors that can feed ongoing use. And sometimes people are really aware of it, and sometimes it can just really feel like a mystery to them. Now, that said, people are much more likely to be able to reflect on and better understand and talk about what is contributing to their substance use when they experience us and their services as safe, as trustworthy, as non-shaming, and as non-coercive. Now, every person's reasons for using are unique and dynamic, but I'm just going to give kind of like a taste of some of the interrelated issues to consider. So one of the most kind of like common and simplest reasons is continued use to avoid withdrawal. So it's really common, and here understanding that withdrawal occurs on a continuum from none or very, very mild, like a headache, right, to severe, which in some cases may require some medical support. So uncomfortable withdrawal tends to be more associated with it really depends on a person's pattern of use, but, you know, it also tends to be associated with what kinds of substances they're using. So a more kind of just uncomfortable withdrawal tends to be like stimulants such as cocaine and methamphetamine, cannabis, tobacco. This is where, like, you know, nicotine replacement support for tapering is really evidence-based. Opioids, very, very uncomfortable, but it's only life-threatening if the person has other chronic health concerns or generally poor health. That said, withdrawal and cravings are so intense with opioids that when folks aren't stabilized on some kind of medication-assisted recovery, there is a huge risk for accidental overdose. And so this is where these medications are really life-saving, and that most treatment providers are taking a medication-first kind of approach. And that's really what's evidence-based and considered best practice. Now, potentially lethal withdrawal includes alcohol, which obviously there's a huge continuum here. There's people who never experience, you know, life-threatening withdrawal from alcohol, and benzodiazepines, which is a kind of medication used to treat anxiety like Xanax and, you know, Valium and medications like that. So people may need access to some kind of medically managed withdrawal. That may be a potential. Now, so as I just mentioned, withdrawal management may be needed, but it can be really difficult to access for survivors, especially when folks have children in their care. At the end of the day, it's not for us to determine whether or not someone needs withdrawal management services. That's really a conversation that we could potentially ask survivors if they feel like that's something that they're interested in, if they feel like that's something that's helpful. But it's never for us to, you know, require a person to go through withdrawal or detoxification for so many reasons. First of all, because it's not aligned with survivor-defined approaches. Also, because withdrawal and detoxification, you know, if we're forcing that actually just, that really replicates the abuse because it's so common for threatened or forced withdrawal to be a tactic of substance use coercion, right? So we could be really unwittingly re-victimizing somebody if that is something that we are requiring of them against, you know, without their kind of choice, right? And then also thinking about that if somebody goes through, for example, withdrawal of opioids and isn't stabilized on medication-assisted recovery, they're actually at much higher risk of overdose. So that's kind of an ethical concern there, right? That we shouldn't be requiring any kind of service to access our DV services. It should always be survivor-defined and survivor-led. Now that said, there are so many complex barriers to treatment for survivors. And so a big reason why people continue to use is because they just can't access treatment in any kind of meaningful or timely manner. And so while it's not for us to determine whether or not someone, quote, needs treatment or, quote, should go to treatment, we do want to have collaborative relationships with treatment providers, and we do want to know what is out there, what's available in terms of substance use disorder treatment, recovery community organizations, mutual aid groups, and harm reduction services and organizations. What kinds of resources are out there so that we can help really, you know, address all the barriers that exist to these resources? So there are so many different barriers, from transportation and childcare to lack of funds to access treatment to stigma as well as a fear of negative interactions with child protective services, especially when there's substance use coercion and people fear their treatment records being subpoenaed in kind of a child custody proceeding or different kinds of legal proceedings. And so this is where, of course, confidentiality is so important, but still records can be subpoenaed. And so this is where it's really important for treatment providers to have really kind of to be aware of best practices when it comes to documenting, substance use treatment services when somebody is experiencing domestic violence. Survivors may also continue to use in order to numb pain or anxiety and to experience joy or connection. Now, these are normative experiences that we all need and want in our lives, right? We all need and want to, be able to cope with our pain, to cope with our anxiety, and to experience joy and connection. These are really human, needs. I won't even say desires. They're human needs, right? And so what is it that gets in the way of being able to access this so that the use of substances feels like really it's needed in order to cope, in order to experience joy and connection? And that this is where, again, the domestic violence is a big factor here, because we know that victimization by an intimate partner increases a survivor's risk for depression, for post-traumatic stress disorder, for self-harm and self-injury, for suicidal attempts, and for substance use disorder. And so the last thing we want to do is, replicate the power and the control, right? That our service, that's actually can be re-victimizing and re-traumatizing. So our services always need to be really the radical antithesis to the abusive tactics. And when we can understand from somebody's point of view, why they continue to use substances, then we're no longer focused on trying to get them to stop doing something, and we can actually just show up as a support in their lives, as an advocate in their lives. So ultimately, the only way that we can really start to understand what might be contributing to someone's use is by cultivating a safe and supportive environment where we actively listen to them. Active listening within a safe and supportive environment for the person to be able to trust that they can talk openly with us about their substance use, right? Because we're overcoming decades of expectation of people expecting to be emotionally abused for their substance use, being controlled and having their choices taken away for their substance use, being disconnected or kicked out because of their substance use. So we need to be able to build trustworthy connections and safe and supportive environments when we are actively listening to them in order to really understand, right, what might be contributing to their substance use. So here are some conversation starters if it is safe within our program for someone to talk about their substance use. Here are some different examples. The first one, many people have shared with us that their partner or ex-partner pressured them to use substances or use in ways they didn't want to. I wonder if you or someone you know has gone through this, right? So letting folks know, we're not just out there saying like, hey, have you experienced substance use coercion, right? Because we don't, that's a label, and we don't want people to have to try to interpret what it is that we mean when we say that. And so really providing some information in our question, kind of describing substance use coercion. And notice here that, we're asking about substance use coercion, not just substance use in general, right? Because for survivors, asking about substance use coercion is much more an accurate reflection of their experience of substance use. So if I've been coerced to use substances, or if I've used substances because, when I don't, the abuse is that much worse because my partner expects me to be on the, quote, same level as them, then, and someone just says, hey, do you use substances? I'm going to say no, right? Because my experience is that I've been coerced to use. That's not like part of my life. It's part of the abuse. And so here, really focusing on asking about the actual pattern of abuse. And we've heard from many providers that this opens up much more conversation because it more accurately kind of matches what someone's experience has been. The second one I especially like, and I've heard from providers that it's really helpful because it lets folks know, hey, if you've experienced this, you're not alone, and we're here to help. But it doesn't put people on the spot and kind of force them to decide right there in that moment if they want to answer this question. So let me read it out loud. Sometimes people who have been hurt by a partner find themselves using substances to deal with the pain. This is a pretty common reaction. If this is something you can relate to, know that we're here to support you. So what folks have found, and they've shared with us, is that when they use this as a conversation starter, then as people start to feel like safe in the provider relationship, as they start to feel safe in the program environment, they know that they can come to staff and talk about their substance use and get help around substance use coercion, but they don't have to feel like they're being kind of like confronted or that they're being, asked right there and then on the spot to disclose something that can feel really vulnerable when they're just first meeting a staff member. So that's worked really well, and some of the providers I'm thinking about right now are specifically DV residential programs. And then as we are talking about substance use with folks and we have more kind of built trustworthy relationships, then just very kind of, directly asking folks, people usually have their own reasons for using substances. What do substances help you with? A lot of times people already know all the bad parts about it, right? And we don't need to kind of like continue to bring that up in people's face, but it is really helpful to understand what is the substance use helping them with, because that opens up a whole conversation around what kinds of support and resources might be helpful so they have different kinds of options, aside from the substance use. For programs that are already asking about a partner's or ex-partner's substance use, many times this is part of like a danger assessment. So if this is something that your program is already asking, something that you can really easily fold in is, asking these substance use coercion questions that are focused on the partner's pattern or the ex-partner's pattern. So does your partner force you to use when they use? Have they ever spent all your money on drugs or alcohol without your consent? Does your partner's use affect your use? And this may be the case even if a survivor is not using substances, that the second question in that group could still apply, because that's very often a part of the financial abuse, right? And then the second part gets more at the coercion into illegal activities, which many times can overlap with some experiences of human trafficking. So has your partner ever forced or coerced you into doing something illegal or other things you felt uncomfortable with in order to get alcohol or other drugs? So there are some conversation starters and different questions that you can ask. From there, we want to really validate and affirm. Sometimes sometimes we feel this tug to jump into kind of like problem-solving mode, or like, okay, you have to go to treatment, or like, okay, now we have to do this, right? But we really don't want to get ahead of ourselves. And it's really important to stay survivor-centered, because so often folks, really hesitate to talk about their substance use with us because they feel like it's just going to take over the conversation. Like they're not going to get to talk about what's actually important to them anymore. So first, we just want to slow ourselves down if we're getting ahead of ourselves. And we want to really respond with validation and by affirming them. So first, affirming that it is never their fault when someone harms them. And this may be an opportunity to provide some just education around the pattern of power and control, and that the partner may find other people to agree with them that their substance use gives them a right to control a survivor, right? And so letting folks know, undermining your credibility with other people is a way to strengthen their control, right? So really providing some of that education. And of course, letting them know, I believe you and you are not alone. And then from there, we want to just offer support, supporting safety and coping as well as resource access. So here, we want to just open up conversation or offer conversation around, would it be helpful to develop some safety strategies and think about resources that they might find helpful. You'll notice that this doesn't include any specific follow-up questions about substance use, but matters related to substance use are likely going to come up in the course of safety planning that flows from discussions about substance use and substance use coercion. But there's a reason that our focus isn't on just kind of like trying to find out more about the substance use. And this is so that we're not just steering the conversation away from what the survivor defines as their needs or as helpful. Now, if substance use doesn't come up again in the course of safety planning and reviewing desired resources, don't feel pressured to steer the conversation back to substance use. A lot of times people need to see that we're not going to force the issue in order to feel safe enough to talk more about it with us. If substance use, if you kind of get to the end of safety planning and talking about resources and substance use hasn't come up again, we can just kind of casually ask before wrapping up whether there are any additional situations or safety strategies involving substance use that they'd like to talk about or that it would be helpful to plan around. We can also ask whether there would be any changes to the safety plan depending on whether or not their partner or ex-partner has been using substances or is experiencing withdrawal, or whether they're experiencing intoxication or experiencing withdrawal. So, for example, if part of their kind of like escape safety plan is being able to have a set of car keys and like a getaway, bag in their car, let's say, for example. What changes might be needed to the safety plan if they were under the influence or if they were experiencing withdrawal and it's not safe for them to drive, right? So kind of having those kinds of conversations. But of course, it's really important to ask permission. Ask permission as we kind of dive deeper into conversations around substance use as well as, offering kind of, unsolicited advice or resources around substance use. So this can be really, really simple. So unless the person has directly asked for, advice, resources, information, these kinds of things, we can just simply say, hey, I have some information you might find useful on, let's say, recovery resources in the community. Would it be all right if we go over it together, right? And then and then if we want to ask more questions about substance use, if it feels like that would be helpful, then asking, right? Would it be all right if we took a moment to talk a little more about substance use right now? And really important, if people say no, to respect the no. That is crucial. So a couple things we can do. We can ask them if it would be okay to check in with them about this in the future. And here you have a way to kind of just, ask about that. And then if they still say no, we can invite them to bring this up with us anytime. Let them know, I hear you. Please feel free to bring this up with us in the future if we can support you in any way. Now, in order for us to be really kind of not only non-judgmental active listeners, but actually helpful listeners, we need to know a little bit about substance use. Not so much that we become substance use counselors, but just a little bit more about substance use. So first, I want to just point out that there's a lot of stigmatizing language and a lot of different kind of disagreement in the field around, substance use, what causes it, what recovery looks like, whether or not someone has a substance use disorder for the rest of their life, right? There's like so much disagreement. And a lot of these different kind of words that we use and the different ways we think about substance use have a historical context. What we want to do is practice using empowering anti-stigma person-first language. And one of the handouts for today, that's a handout for today as well as in the guide, is a page on language and definition. So first, understanding that substance use exists on a spectrum. So not all use means that it's out of control, substance use disorder, chaotic use, right? That there is a spectrum here. And that actually, so when we're thinking about what is a substance use disorder, that, it's not, as an advocacy, it's really not our role to be diagnosing anyone unless we're in a program that offers kind of integrated counseling that's based on a health diagnosis. But by and large, it's not really our role to be diagnosing anyone. But, one way that we want to understand, in really understanding the spectrum of substance use, one simple way that we can understand, whether or not what we're seeing is kind of falling into that, quote, addiction category, because addiction is such a kind of tossed around word that gets overused, and it becomes almost meaningless with how much it gets overused and how poorly defined it is, that one simple way of kind of describing it is these 4 C's. Experiences of craving, loss of control, compulsion to use, and use despite consequences. The hallmark feature of a substance use disorder is continued use despite consequences. Now, so if we're trying to change someone's substance use behavior through rules and consequences, it's not going to work, and actually we're setting people up to fail. So structure can be helpful in recovery, but not control. That actually tends to be really harmful in recovery. Now, one thing I want to point out really quickly is that, craving alone would not mean a substance use disorder or an addiction. I remember when I stopped using tobacco that I had cravings for tobacco for like a solid 5 years after I had quit. So craving can be something that comes and goes long after somebody is no longer in any kind of active use. So here, looking at the data from SAMHSA's National Survey on Drug Use and Health. So this is from U.S. data, and this is looking at the rates of illicit drug use in the past year, so all substance use aside from, alcohol and tobacco, and then the rates of illicit drug use disorder. So as you can see on this chart, the vast majority of people who use an illicit substance do not actually meet criteria for a substance use disorder, which means that someone wouldn't even qualify for treatment. So if we have a program that is requiring any kind of treatment engagement as part of accessing advocacy services, not only is that not aligned with kind of FIPSA regulations and other kinds of regulations governing DV funding, but we also may be sending people on a wild goose chase because they may not even qualify for treatment, right? And folks may not even come to know that. They might just try to find treatment and give up because treatment is so hard to find, right? So there's a lot to consider here. Not all substance use means that someone has a substance use disorder. So if we're going to break out of an all or nothing view of substance use, how do we understand substance use, right? And so another handout from today's session that's also in the guide is this whole section on understanding the dimensions of substance use. So this part of the guide provides a framework for unpacking the uniquely personal dynamics of substance use experiences. And that this makes it really, this really supports deepening empathy, active listening, individualized approaches, and collaborative partnerships with survivors. So substance use experiences tend to be highly individual and influenced by these three key factors. First is the drug, the substance itself, how we get it in our body, how much we use, and ultimately the chemical action that it has on our brain. Then set. Set is kind of everything happening inside of our body, including our mind. So both our mindset and our disposition before use and during use, as well as our physical health. So whether I have any physical health conditions, or whether I've eaten that day, as well as what I expect from the substance use experience. Do I expect to be able to kick back and laugh and have fun? Do I expect to finally be able to fall asleep after feeling like, after an anxiety attack, right? Like, what are my expectations from the substance use? Something to note here is that experiences of fear, guilt, anger, and shame often increase use, particularly more chaotic or riskier patterns of use and more distressing substance use experiences. And then finally, the third part of this pie is the setting. And this is everything external to us that is going on. So both the social, cultural, and physical kind of elements of our setting, as well as whether I need to hide my use, the time of day I'm using. And something to note here is that when people need to hide their substance use, that often leads to more chaotic and riskier patterns of use and more distressing substance use experiences. So if you're working in a DV residential program and somebody, just came in, to the setting, and you're, noticing maybe that they're experiencing some more kind of chaotic substance use. Something to really think about right away is they've had a major change in their setting, right? So one of these three factors has just had a huge change. And so the kind of pattern of use and the substance use experience that you're noticing right now they might be using the same amount they were using before, but now they're experiencing much more adverse effects. They're experiencing a lot more kind of, chaos in the substance use experience that may not have been the case prior to that change in setting, right? So this helps us start to kind of consider what is coming up, what is going on, what are the factors at play. So now I'm going to walk us through a couple of examples. So here it is all in one place, so you can kind of just see it again all in one place. And then, of course, there's the handout. And now I'm going to walk us through a couple of examples. So here, I want you to start thinking about, okay, what part is the drug, what part is the set, and what part is the setting? And something that I've heard from a lot of programs, both DV programs and substance use disorder treatment programs, that has started using this framework and better understanding somebody's substance use, is that they find that they then start using much more empathic approaches and much more strengths-based approaches, and that they start kind of noticing all of these different potential strategies for ways to reduce risk and mitigate harms. So I'll just kind of walk us through this. So Cassie recently entered a DV shelter. As she grew more comfortable with staff, she shared that she uses cannabis daily to manage her feelings of stress, sadness, and loneliness, and to help her sleep. She usually eats cannabis food before going to bed and finds that it helps her sleep on most nights. She will only vape cannabis when she's feeling very anxious or has trouble falling asleep. She avoids vaping cannabis because she knows she cannot vape in shelter and is afraid of being stalked or encountering legal problems when she vapes in a public area alone late at night. Cassie shares that she needs to find a job but is worried about being drug tested by a potential employer. Otherwise, she finds it to be a more, quote, natural way to cope than taking prescribed medication for anxiety or sleep. She gets along with most residents, but staff notice that residents sometimes make snide comments as Cassie has reddened eyes. So, without passing judgment, without, good, bad, and different, right, without passing any kind of judgment, just trying to understand the different dimensions of Cassie's relationship with substance use. So the drug. So here we see cannabis food, so cannabis that she is eating, and then cannabis that she is vaping, and that the vaping is only happening about twice a week, whereas the cannabis food is happening typically every night or most nights. Now looking at the set, right, which is kind of everything happening kind of inside of Cassie. So we see that her kind of goals around her use is to manage her feelings of stress, sadness, loneliness, and to be able to sleep. And that before she vapes, she's usually feeling very anxious or having trouble falling asleep. And that while she is vaping cannabis, she is usually feeling afraid. Some other things, some other kind of thoughts related to her substance use is that she's worried about being tested by potential employers, but that otherwise, kind of her view of her substance use is that she finds it to be a more natural way to cope. Now, looking at her setting, so everything kind of external to Cassie. She's recently entered a DV shelter. She is, her environment is staff and other residents. She gets along with other residents, but, staff, here it says that staff notices that residents sometimes make snide comments. We're not really sure if Cassie's aware of that or not. More than likely she is, because survivors, are able to survive by picking up on these vibes, right? That's how we're able to survive very dangerous situations. And her setting is also, another use setting is a public area alone late at night. So hopefully start to notice kind of all, as we unpack these different pieces, you start to notice different places where Cassie might choose to use different kinds of strategies to reduce her risk, to make potentially different choices around her substance use. Not that we're kind of forcing that or demanding that, but to just have a much better sense of her substance use overall versus just a binary yes or no approach to substance use. Like it's either you're sober or it's all bad, right? We need to move beyond that in order to really provide survivor-defined approach. Now, I do have another scenario here, but we are just about out of time. So I won't be going over Sabrina's scenario, but you do have the slides here in case you do want to review another example of walking through drug set and setting. Ultimately, what we need to do as providers is strive to create a safe and supportive environment that when we can truly show up without judgment, without an agenda, without artificial consequences, without trying to convince or persuade people, and with our full presence, our full attention and support of people's choices, that we're creating a space that is truly healing, that truly fosters connection, empowerment, and healing. So next in the series, these are all of what's coming next in this series and covers each major part of the guide. So in January, I believe we are scheduled for the 27th, we'll be looking at organizational policies and practices that promote safety within programs as it relates to substance use. We also will have an online resource hub dedicated to supporting survivors who use substances within residential settings. And we'll feature an array of different kinds of tools and resources on that online resource hub, because we recognize that, using a lot of these different strategies and skills in a congregate living environment and just residential settings in general can present more unique different kinds of situations. And if you're interested in being interviewed for this or spotlighting your program, please, please, please feel free to reach out to me. I am currently scheduling these interviews, and I would love to feature your program if you would like to be included. So some additional resources on our website, my contact information. Please feel free to reach out to me, as well as connect with us on social media. And then I'm just about at the end of time, but I'm going to glance. So folks have to, log off. I totally understand, but I'm going to take a moment and just glance at the Q&A to see if there's something that, any questions that have come in that I might be able to answer quickly. And if you can't stick around and you have any questions, please feel free to email me. I'm more than happy to provide some TTA. And I'm so happy to hear from survivors, from programs, from practitioners and advocates. And the more I hear from y'all, the better resources that we can develop as a center. So please never hesitate to reach out to us. All right. Thanks, everyone. I'm not catching any questions in the Q&A or in the chat. So I'm so sorry if I did miss your question, but I just want to say at this point, thank you so much. And, of course, feel free to reach out with any questions or any situations that come up. I'm happy to help. Thanks, everyone. Have a great rest of your week.